It's officially been 1 year since the coronavirus made land on U.S. soil. A year later, just under 400,000 Americans have died as a result of the pandemic. Shelby Roberts and I got the opportunity to speak with Dr. Anthony Fauci, the director of the National Institute of Allergy and Infectious Diseases. We're asking the questions you want to know about COVID-19, vaccine rollouts, and where the country went wrong. Here's a first look at that exclusive interview. What do you wish we as a country would have done differently to battle this pandemic? And do you believe political struggle between parties hurt our response to the virus? You know, we saw Twitter spats between Illinois Governor J.B. Pritzker and President Trump, causing some to believe that some lawmakers were making COVID a political issue, causing more lives to be lost.
Well, I'm not going to comment about any specific person or entity politically, but I can tell you something generally that could help to answer your question. I think anybody who's been watching what goes on realizes that we in our country, unfortunately, are living in a very divisive period, extremely divisive, to the point that it has led to the kind of violence that we saw last week. That is very troubling. When you're trying to address a global pandemic that's throughout our own country, has devastated to the point of having really unprecedented deaths, hospitalizations, the worst we've seen in 102 years since the 1918 influenza pandemic, that when you have divisiveness and things get mixed up with political ideologies, that is never a good thing when you're trying to fight a pandemic. Everybody needs to be pulling together. So if there's anything we could have done differently, is that lay aside political or ideological differences and all get on the same page to realize that we're all in this together, and the only way we're going to get out of it is by getting out of it together as a unified nation.
More of a personal question. How has the pandemic impacted you personally? Obviously, being the face behind this battle has its challenges, I can imagine.
Well, I mean, it certainly has completely consumed my life. I can tell you something, not needing any sympathy about it, but it's the truth. I haven't had a day off since last January, namely January of 2020. So it's been something that I feel we need to do because the enormity of the problem requires 24/7. And that's what I and many of my colleagues have given to it, 24/7. So it's been exhausting. The thing about it that has underscored this divisiveness that we're talking about is that I've experienced what some others have, is threats upon my life and harassment of my family, including my wife and my children, by people who disagree with my public health message. Now, try to get your arms around that one, that when you disagree with someone's public health message, you actually threaten their life. That's no way to contain an outbreak when people feel so strongly about things that they let a public health message trigger that kind of response.
And we got a chance to ask Dr. Fauci about a lot more topics, including the new strain of the coronavirus and President-elect Joe Biden's plan to tackle the pandemic. Tune in to Good Day Central Illinois for that full interview that you won't want to miss.